Greetings from sunny Southern California. For those of you who haven't met me, I'm Dr. Tim Silegy. I'm an oral and maxillofacial surgeon practicing in Long Beach and Corona del Mar, California. And I'm back. It seems that, just a few weeks have passed since we were together in the sunny desert skies of Palm Springs. But I wanted to mention a few of the points maybe we hammered home last year. When it comes to implant dentistry, as we try and expand the treatment of choice for the replacement of missing teeth, we found that we really need to make it as close as possible to conventional dentistry. To do that, it means we have to have a process that's affordable for the patient, but also something that's going to be profitable for the clinician. I really wanted to assure you that you as Zimmer representatives are members, critical members of a team that allow us to make differences in the lives of our patients every single day. And believe it or not, dental implants make a significant difference. So that's what I'm here to share with you today. I'm going to share with you the story of 4 or 5 patients and how they came to my office, how I worked with the restorative dentists, and really made some unique and great things happen for them. First patient I'd like to introduce to you is Mark Fisher. Mark is middle-aged, 56 years of age, and was referred to me by a prosthodontist who was faced with the challenge of trying to deal with the fact that Mark's dentition was just generally failing. And Mark had some very, very significant emotional concerns over the fact that he was losing his teeth, and a lot of trepidation as to removing those teeth, what was going to go back in. And I really think you'll appreciate Mark's story. Tell us a little bit about how you got here with me.
Okay, sure, happy to. I think I had childhood periodontitis is my best guess. I had bleeding gums that were misdiagnosed as just vitamin deficiency, and it was that way through high school and college. And I started having a lot of bone loss and had braces late in life because I had too many teeth in my mouth, had some extractions, and nothing ever really just got right after that. Mm-hmm. And I had damage to a bridge and was talking to my periodontist and said, what do you think the best option is? And they said, probably should have an implant. And I said, well, like 1 or 2. And they said, probably 14.
Now, the concept of you, when you came to see me, you had teeth. They didn't look great.
Right.
And some of them were loose and you had some bad bridges, but you had teeth.
Right.
When you hear the idea that, we're going to take out your teeth, and, down the road, you're going to look great, but you have this process. What kind of went through your mind? Was it an emotional experience for you?
Well, I probably had that emotional experience at the periodontist when they said 14, when I thought they were going to say 1 or 2.
Right.
So that kind of got me mentally prepared a little bit. Mm-hmm. So it was a little bit of a shock.
Yeah. What's it meant to you now? I mean, you went through the procedure. It was probably, before we had you totally finished, close to a year, I would think.
It's been
right?
a little over 2 years.
Start to finish. Okay.
Yeah.
So now you're finished?
I only finished for 3 weeks, and it's been great.
Okay.
I've just been loving it.
Are you getting comments from any of your friends, or what's up in your life right now with your new?
Well, most people don't even know it, which is, I think, the plus, right? Mm-hmm. That people don't look at it and say, "Oh, what have you done?" Mm-hmm. Most people probably didn't remember, and they just see me with a great mouth. But I have some friends that just I told and kind of kept informed while I was doing it. When they'd see them, they'd say, "Wow, that just is great. Mm-hmm. That was the best thing you could have done." Mm-hmm. Matter of fact, some of them kind of wish they had done that. They're doing late adult orthodontic work and stuff, trying to manage their bite and things, and they almost say, "Yeah, I wish I had done that."
Mm-hmm. Absolutely.
Not that they would want to go through all that,
yeah.
but they're a little envious of the outcome.
Oh, I'm envious of the outcome. I mean, your teeth look fantastic. Will you look into that little camera right there?
Sure.
And give a big smile? Zoom in on those. That's great. One of the most frequent types of cases that I get in my practice involve a failing bridge. The next patient I want to introduce you to, Robin Watson, always took impeccable care of her teeth. And over time, with regular attrition or a tooth fracture, she lost a couple teeth and ended up with a very long span bridge on the left posterior mandible. She came to me not wanting to repair this bridge that was failing And her restorative dentist convinced her that bone grafting and implant placement would give her the result that she wanted and really not let her have to worry about having another bridge that would fail over time. I think you'll enjoy meeting Robin. A few years ago, you had I think it was a fairly long span bridge on the lower left, right?
Yes.
And you were biting down on something or it loosened. Tell me what happened.
Well, because of the bridge was over a tooth that had been extracted when I was a very young teenager, and then I had the root canals, I believe, on either tooth, and everything weakened, and then I started having some pain and some discomfort. And when my dentist told me that we just had to do something, he suggested the implants, which was a little frightening at first to me.
What aspect of it frightened you?
Well, I think just the fact that of something going into your jaw, it would be surgery, and that was a little scary to me. And I was ready to do something, though.
Now, the procedure itself, I mean, you're a dental veteran, right? You had a lot of dentistry.
Yes.
How did having the bone graft and the implants compare to what I think you told me earlier, 12 root canals or something like that? What was that comparatively for you?
Well, I don't know if I can compare them. I think the process was different, of course, but it was easier. I will tell you that. I have never experienced any pain with this, with the implants. Where with the root canals, I definitely did, and I experienced it for each one for a long time afterwards. So, just because of the tissue damage around the tooth, I'm not sure, but this was painless, I will say. I've never felt any pain from start to finish.
Well, let's just do one thing, see if we can get the camera to zoom in here. See where the camera is?
Oh, yes.
Zoom in there and let's see her beautiful smile. So last year we spoke quite a bit about the interaction between the specialist, person who's placing the implants, and the restorative dentist, and just wanted to get Dr. Urban's take on things a little bit. He was the one who did the tremendous job on the patient we just looked at. And Doug, you know, when someone comes in like that and they've had a lot of conventional dentistry that, you know, was great, but it was just 20 years ago or 15 years ago, and they start to see failures. What's been your approach with dental implants and offering that to them?
Well, dental implants have become the #1 choice in my office, where I would say 5-10 years ago, I was doing the 3-unit bridges and kind of avoiding the implant approach. Now that I mention implants, people still have a little reaction to that. And I try to tell them that implants are a common surgical device for hips, knees, ears, facial prosthesis, and they're very safe and very proven. They don't always all work, but most of them do, so that's the nice part.
But typically, what's your experience been with implants? Do you think we've to the point now where it's something that allows you to be, you know, profitable while delivering an affordable service to patients?
Oh, absolutely. I like implants because it just adds another tool to the chest, and I have a lot more confidence in implants. I can suggest to people that to replace that missing tooth, it's much easier to have the implant put in, and depending upon, you know, the case and the difficulty, that's the way to go.
Whitney Foltz, our next patient, was congenitally missing lateral incisors. We had the complicating factor with her is that she was scheduled to do several photo shoots during the course of her treatment, so we didn't have the luxury of a 2-stage procedure, or for that matter, even using a removable partial denture while she was healing. So I'm really excited about how Whitney's case turned out and how we were able to take care of her needs and allow her to actually have photo shoots while her implants were healing, while she was in temporaries, and then her final result is just wonderful. I can't wait for you to see this case. Whitney, what was it like, you know, kind of growing up, being a teenager, preteen, and kind of missing a couple teeth in front?
Yeah, it really wasn't very fun. I ended up having to have braces a couple years longer than I would have liked to because it helped me have teeth. So, and then I also had to wear a retainer for a very long time. I had a retainer in for about 10 years with my flipper. It was very noticeable, you know, my smile. I couldn't smile full, you know, big smile. I was always very self-conscious of my smile. Well, recently I became a model, so I smile a lot now. You know, it's part of how I make a living. So, and it definitely, because of the surgery that I received from you, my job is now, you know, much better. So,
It is, really?
Yes, I'm not having to hide, you know, not smile as big because I can't show my gums as much. That's been the biggest thing, that I can really be myself in front of the camera and smile full out and not be self-conscious about how the gums are looking over my teeth. I was very, very pleased that it was all one day, get the flipper in, then the temporary is over. Or get the implants in, and then the temporary is over.
Well, I know you're an experienced model, so the camera's on you. Can you, like, strike a couple poses for us?
No.
Come on. Zoom in on that smile. Isn't that great? The next couple of patients I'm introducing you to, John Dixon and Dot Hamilton, really personify everything that's great about being a senior citizen. And I think they really are going to share a wonderful story with you, and a story that will show you how even the smallest thing like a dental implant can make a very big difference on someone's life. Can you think back to, like, when you first came in and, like, what was going on for you?
You scared the hell out of me.
I did I? Okay. So what was going on?
You pulled a tooth.
Okay.
You had to pull a tooth.
Yeah.
And you said, you're going to have dentures.
Okay.
I don't know if you remember that or not. And I started, you know, I said, well, my mom had dentures, my dad had dentures, my brother, and they just floated around their mouth.
Right.
And what's the alternative? And then you said, implants. I said, okay.
So, John, when you came in, you were on a little bit of a time crunch because you wanted to get all your implants and your new smile and all that done within a certain period of time. What was going on? What did we need to get everything finished for? You were going to take a little trip back in time? You were going to go somewhere back
Go back and see Dot.
You were going to go back and see Dot at your high school reunion,
Yes.
weren't you? Is she here?
Yeah.
Where's
here.
Dot? Dot, get in
Hey,
over
Dot.
here. So, you bring Dot back to California, right?
Sure did.
And did you need a little dentistry work done?
Yes, I did.
You did, didn't you?
Well, she didn't think she did.
Okay, but I think, like, when the first couple weeks you're back, you brought her in to see me. You said,
Yeah.
Doc, let's do some implants, right?
Well,
She was-
I had a bridge and I had a partial.
Uh-huh.
And he didn't think that looked very good, you know.
Uh-huh.
Yeah, so he said, I'll pay for it. Well, you know, if I can get new facelift, I'll take it.
Dr. Witzling has been my family doctor, and he took care of Dot when she came here. You know, whenever I told him I was going to get implants, he discouraged it. He said, John, he said, I'm not sure that your body can stand that. You know, you're not 21 years old anymore. Dr. Witzling just retired December 31st this year. And he told me, he said, John, the best thing you ever did was have your implants. It increased your health, made you a different man. And I believe that.
I thought it was me.
A little bit of both.
A little
okay.
bit of both.
All right. You know, I am so lucky to be an oral and maxillofacial surgeon because I get to work with people like that every single day. Whether it's a young lady who's taking the world and making it her own, or a senior citizen enjoying everything that life has to offer. It's so rewarding to me to be able to offer my abilities to make their life a little bit better. And, you know, a lot of times people ask me, they say, how come you just have one implant system? Why don't you have like 5 or 10 or however many? And the true answer is because the Zimmer system allows me to solve virtually any problem there is that has an implant solution. You know, Zimmer as a company corporately, Zimmer Dental in particular, is truly committed to changing lives. And I know that each and every one of you is committed to making the world a better place, maybe one smile at a time. I know I am. And I know that I couldn't do that without all of you. And the truth of the matter is, I am Zimmer too. Have a great conference.